here today at the St. John's School of Risk Management in Lower Manhattan. St. John's School of Risk Management is part of the Tobin College of Business of St. John's University. I'm Brandon Sweitzer, Dean of the school and Associate Dean of the Business College. And I'd like to welcome today Matt Dolan and Josh Stein of Iron Health.
Thank you. It's nice to be
Thank
here.
you for being here, fellows.
Thank you.
We're here to talk in this segment about the physician provider model of health delivery, capitation issues, and the important issue of cost and efficiency in the health system. What, from an insurance and risk perspective, is going on? What are the issues, the topical issues of the day, apart from the headline news of bending healthcare curves, the Affordable Care Act, the implications of that, and the like? What's going on in the risk dimension?
Well, I mean, I think that obviously we focus, in our business, we focus exclusively on risk. That's where we are going to provide solutions to potential clients. It's where we're going to also have our own issues if we can't stay up with the curve. So what we do is we think about these evolving business models. We try very hard to stay ahead of what those new business models are exposing the organizations to, potentially, and try to create solutions for them. Yeah.
When you talk about business models, be a little more specific.
A perfect example. The fact is that you have a lot of physician groups, for example, and physicians in independent practice who have decided, you know what, it's time now. I've had it. I've had enough. I'm going to move. I'm going to go out of private practice. I'm going to become an employee of a hospital because I can have a more predictable schedule. I get a salary, and I don't have to deal with the reams of paperwork that typically I have to deal with for Medicare, Medicaid, and these private.
If I do that, does the cost of my liability change?
Well, potentially it could, and Josh talks about sort of the overhead drivers that a physician or a group of physicians might have to consider in joining with a hospital. Hospitals are thinking about the reimbursement methodologies and specifically the changing reimbursement methodologies that are going to be more predicated on outcomes, the efficient delivery of care. And a big component in delivering care efficiently is coordinating care. And the coordination point is critical between the hospital and the physician. And if a physician is part of the institutional delivery model, the prospects for coordinating that care more effectively become greatly enhanced. If you understand the business and how organizations come together, how they organize, how they look to make money, how they operationalize against some of the meaningful operational challenges, you will understand the risk.
Let's for a minute draw a line under the state of hospitals and healthcare providers, and let's talk about doctors. Let's talk about capitation. What's the state of risk mitigation, risk prevention, risk transfer as it impacts docs in this country today? Josh?
Capitation was a reimbursement methodology that was very popular out in California and in other states in the union, but it began to get decreasingly so. It really, as a reimbursement methodology, it really began to go away. And I remember 10 years ago, Matt and I, in our business, we thought to ourselves, capitation is dying out as a reimbursement methodology. What's happened, though, is that the Affordable Care Act has new provisions in it that allow providers to assume financial risk. The view is that if they take the risk of the downside, they also have a benefit on the upside. If they're able to manage a population more effectively than Medicare says that they ought to be able to, or historically have been able to, they'll get the benefit of that. On the downside, of course, if they are not able to achieve those advantages over what they used to charge, they're going to have a financial downside. So capitation, whether specifically a per member per month concept or in more general, like what Medicare is doing with the Affordable Care Act, financial risk is coming back into the provider side, which means that the providers are going to be looking for a way to stop that risk.
I think what I hear from you both is that we are either in or on the verge of seismic changes in the whole healthcare provision industry.
Today you have a highly fractured healthcare delivery system. You have healthcare organizations facing declining reimbursements from Medicaid and Medicare, tending to a highly acute patient population with limited ability to invest in infrastructure and to reinvest in their own operations. From that, you have a catalyst in the Affordable Care Act that wants to move the industry to highly coordinated, very efficient, from volumes of patient care to value of patient care, and they want to do that in a more economical way. So when you think about it, the gap couldn't be greater, and we think about what happens along the way as healthcare goes from today's current reality to the aspirations of tomorrow, and that's a very, very complicated progression.
Well, then these are the pressures. And now, is it fair to say that there has to be a more cohesive industry, or is that
A more coordinated industry.
now? Does that get to the issue of mergers and acquisitions, other delivery systems?
It does. I mean, the Affordable Care Act in particular puts a premium on coordination of care. They create what are called accountable care organizations, which are coordinated healthcare delivery organizations where an individual can get the full spectrum of care, from internal medicine all the way up through the various specialties, radiology, anesthesia. It doesn't matter what, they can get it all under one roof. And the concept being that if you can get everything under one roof or in one coordinated way, you will reduce duplicative costs.
And in order to coordinate care more effectively, to do all the various things that Josh talked about, to eliminate some of the waste, some of the redundancy, you have to organize it with all aspects of healthcare delivery, from primary care to acute care to neonatal care, to be able to provide all the required healthcare delivery services to a patient population. That's a precursor theme to merger and acquisition.
We're here at an institution of higher learning, and you're about to take an examination.
It's been a while, okay?
Okay, it's been a while, but that's all right. You're up to it. Josh, you're a physicians organization, and you're approaching your broker or your insurance carrier, and you're going to tell them the three most important things on your mind that you want solved.
You're talking about from the provider perspective, right?
Right.
I want to reduce the cost of my medical malpractice insurance. I want to make certain that the ancillary exposures that I'm now dealing with, some case management exposure, maybe I have a contract with to provide long-term care services. I want to make certain that all my ancillary exposures are covered by my
10
medical
seconds for the third item.
And the third item is, let's see, I would want to find out what the implications are of my business model and whether there's any benefit for me to think about going in-house to a hospital.
Well, thank you very much, students. I want to know before we sign off here today whether you want your exams to be graded on a grade point system or pass-fail.
I'd prefer pass-fail, actually.
Pass-fail. I think we can take care of that. Thanks very much for joining us
Thank you.
down here at the School of Risk Management.
Thanks.